choice is the doctor recommending or talking to a patient far away from the city of Uyo, say work, and it works for us. That is that. Yeah, then the issue of pharmaceuticals. We have the pharmacy departments of the general hospitals all have, and they do have their supplies ordered from abroad, some from Lagos, some from the US, some from Europe. And the Professor Augustin Vision-Umar is a professor of medicine, and they have a very good network for distribution of what we call, I think what they call regularly or very highly demanded. That's the way they put it. You know what? In all the medication that we consume in Akwa Ibom State in each of the hospital, which one has the highest frequency of demand? All right, and they did a statistical analysis. I said, look, let me have a statistical analysis of the most demanded medication, the most highly demanded medicine. So let me have a table of it. Then the specialist is going to look at the table. This is in hot demand. This one is not in so much in the hot demand. And then we play order according to demand. So, and we import them from abroad, and we start from Lagos, Abuja, or Port Harcourt. That's how we function here.
Thank you so much, SSG. This has been really helpful. We're waiting, maybe Akwa Ibom will also have another pharma product after the syringes.
That's correct. We're working on intravenous fluid.
Good to know. So next time we invite Akwabas Ibom, we'll also be asking about how did you bring in, and I don't know if you remember, Olaf talked about pharmaceutical hubs, and looks like you're starting to build one in that area.
Yes, in fact, and I wanted to ask the gentleman, Olaf Schmidt, that's his name, on support for medical technologies, because my background is engineering, my background is electronics, my background is computer and telecom. So automation of processes excite me. And I wanted to know the support for medical technologies that they talked about. We call it digital health. And then the top was medical technologies. We are quite interested in this. At the end of the day, it will shorten the time interval between when an Akwa Ibomite needs medical help and when the help comes.
Thank you so much, sir. We'll make the connection. So thank you so much. And we really appreciate your intervention and joining us. It's been really helpful. Doctor, thank you so much. Dr. Rice, there are a couple of questions. Do you want to respond, Dr. Rice, on the issues? There are a couple of issues on the complexity of pharmaceuticals, and people talk about different partnerships, role of government. How does that, what are the kind of things you think institutions should be thinking about from the government's perspective? What kind of things should governments be asking? Dr. Rice, over to you.
I have three responses that I hope will be helpful. One is to acknowledge that along the supply chain, there are many to map those explicitly, define the ideal roles and responsibilities and authorities and capabilities needed for those governing bodies, and then build the incentives to attract the best and brightest people in each country and across the continent to serve on these governing bodies on each of the elements, and then invest in their capabilities and their capacity. The investment in human capacity for people serving on the governing boards would be a knowledge of good governance, a knowledge of group decision-making, what the risks might be, knowledge about how to not only identify risks, but to mitigate or minimize those risks, and to offer supportive staff and advisors and systems to make those risks not all, but to inoculate, if you will, the organization from future risks by building and investing in the capacity of the managers and the boards that serve in each of those elements of the supply chain, from retail pharmacies to manufacturers of syringes, the basic systems and supportive industries, not just the manufacturing, not just the distribution, but the regulatory oversight as well. So It's a very important question that has many facets. I hope going.
Okay. Thank you so much, Jim. That's really very helpful. And I mean, we'll be sharing your slides at the end. As we come to the end, I was going to ask Dr. Nwida, there were lots of questions around the issue of capacity. There was actually also a specific question on vendor financing. I don't know in your experience if you have any perspectives on sorts of vendor financing, on some making products sort of available at least to folks lower down the supply chain. You know, the second question was also a question about can manufacturers collaborate so they can get lower costs for APIs or equipment. And the issue of governments, I mean, I think everybody would agree, and we're very fortunate to have a senior member of Akwa Ibom government with us. Really, we're talking about what the governments, you know, the issue of tax holidays and those kind of issues are really key. But Dr. Nwida, so I was asking you, vendor financing, do you have any views? The issue of collaboration of manufacturers on common ordering systems, and anything else that governments need to do to encourage the development of manufacturing capacity. I saw somebody here mention stable currency. So over to you.
Yes, thank you. I can have just put a comment to that. I think it's a good question. We know that the biggest issue that our manufacturers on the continent have to either upgrade or scale up their manufacturing capacity is access to affordable and sustainable finance. And so here we need to begin to look at what are the institutions, financial institutions that are available on the continent where the manufacturers can have access to that. And there's a good number of institutions now. I'm aware of Afrexim Bank that supports that. But for them to have access to that, I think there are a number of things that they need to meet, and they need to submit a lot of information. One of the projects that has been going on with the UNECA to support manufacturing in about 10 countries, one of the issues that is being undertaken is to assess the viability of these businesses and then coming up with financial proposals which can then be submitted to a number of financial institutions to support financing of these institutions. So because of the significant interest that is there, we see that a lot of institutions are open to see if they can support pharmaceutical manufacturing. The linkage of manufacturers to highly developed manufacturing companies elsewhere, again, this is a partnership that is desired. Even those who are looking at financing these initiatives, you look at that as a way of minimizing the risk that is involved in this business, because we are now getting sure that that interaction between highly developed institutions or companies and those which are developing now is likely to bear a fruit because of the existence of experience with those companies. And then when you talk about the issue of human resource development, I think you look at this from a number of angles. You have already existing human resource, which will need to be upgraded to get to the required skill level. And then we also have to begin to look at training newer graduates who can fill the gap that's already there. For example, if you look at just the aspects of human resource capacity for those who are required to manufacture vaccines, you notice that already on the continent, it's been established that there's a deficit of about 9,500 full-time employees required in this area. And there's only 3,000 available already. So that then calls for collaborations between the manufacturing companies and the academic institutions to come up with the right curricula and training programs so that we can bridge this gap. So we can have a look at in other aspects of manufacturing or skill set. If you do a needs assessment, most of which has been done, we see that there's that variability and the number of programs will need to be put in place for us to begin to make that step in the direction that we want. But at least we are starting from somewhere, and academic institutions, together with other collaborating partners and the manufacturing companies, are actively responding to this on the continent. There's quite a good number of initiatives going on in this area.
Okay. Thank you so much, Dr. Chiliba. So we're running up pharmacist Botchway, actually is also from the regulatory side. I'm so sorry, pharmacist Botchway, you there?
Yes.
Questions around the regulatory issues. And so with manufacturing, which is new, and sort of expansion into sort of regulatory issues, what are the issues you see from your perspective?
Yes, thank you very much, Egbe. I'm very happy to be here to be discussing this very critical issue on the cycle and governance and so on for pharmaceutical supply chain, particularly. And I think the previous speakers have alluded to a number of issues, having spoken on the chain itself. I think Mustafa was very clear about that, what the chain is, and for pharmaceutical manufactured locally or manufactured, about 70 to 80% of our countries are net importers of pharmaceuticals and vaccines and the other biologicals. And then another critical point in this chain is the granting of marketing authorization, where the regulatory authorities play a huge role here, and then moves to its procurement, whether from local sources or international sources. And again, there are governance issues there as to who does procurement, the capacity of the people who do procurement, and who appoints them, and so on. And then we go to the distribution chain itself, with wholesalers and with retailers and with systems, the technology, even in the wholesale, to track products so that they do not end up in patients' hands as counterfeits and so on. And if you pick these sections of this chain one by one, you realize that a major player in this is government itself, and providing the policy environment for manufacturing, for importation, marketing, authorization, and so on. But you realize, a lot of studies have gone on in this, but you see that there is no deliberate and intentional policy of governments on making sure that the supply chain is secure and that it is guaranteed. And COVID, for instance, exposed all of us to this. Over 90% of countries in Africa have national medicines policies. This study has been done by WHO, and most of the components, which include regulation of the supply chain and procurement and so on, are hardly enforced. Local production has not been deliberate policies of government. It is only in recent times when the country became very exposed and became very challenging that governments are now talking about local production. Then we have a